So, your health word of the day is managed care. This is the type of insurance that we now know as our health care. It has not always been managed care. So, I'm going to explain to you what managed care means, or what our health insurance, how it came to be, and what it is. So, managed care is a type of private health insurance with a focus on preventative care and controlling costs. Private meaning not Medicare or Medicaid, funded by the government. So, before there was managed care, your private health insurance only covered when you were sick, when something went wrong, hospital stays, surgeries, emergencies. Sometimes people had insurance for prescriptions, and sometimes they had it for dental, but these were not always as common. Also, before managed care, people only went to the doctor when they were sick. There was no preventive care. You didn't go to the doctor for checkups. I mean, if the school needed you to go for your children, you would go, but you didn't. But it wasn't common. And insurance companies paid full price. So if you went to a doctor, the doctor submitted whatever bills they submitted, the doctor or the hospital, and the insurance company just paid whatever it was that they submitted. So, as you can imagine, for insurance companies, this was not a great deal. So, what happened was managed care changed by the insurance companies making deals with providers and medical facilities saying, we're going to send you our patients that sign up with us, but you're going to, but at a discount, you're going to give us a break and we'll send you people. So these doctors made up the plan network. So this is how it works. Again, the doctors and the insurance companies came to an agreement that the doctors would take less money per patient, would give the insurance company a deal, and the insurance company would send patients to see them. Um, and so they would get more patients. And in theory, that meant that they would get more money. Also, what managed care did is it says we're going to start paying for yearly physical exams or checkups, going to cover vaccines, routine blood work. So they started to do more preventative work instead of only seeing your doctor when you were sick. This was a new concept. So, the benefit of managed care was that the insurance companies controlled costs because they didn't just pay whatever the hospitals and the doctors submitted, right? They could submit whatever they want, and the insurance companies paid it. Um, and the doctors got more patients, and so they saw them more often, and therefore they got paid more. However, primary care doctors got paid, and may still do at some point, a set fee per month per patient. And so the goal was to keep those patients healthy, in theory, instead of keeping them out of the office. We'll see if that really still works. But in this created the PCP, these primary care doctors. They now managed your preventative care. They managed the specialists that you were to go see. They submitted referrals when you wanted to go see these providers. In essence, they took on even more work. So the impact on these providers is, again, they had to do the billing, they had to do referrals, they had to do prior authorizations, they had to manage the care of patients, they had to decide when a patient could be treated in-house versus going out. So they got more patients, but they got less income per visit, and they had a lot more work that they had to do for that less pay. So which health plans are managed care? As we know it, it's most of them. Even your PPOs, part because there's a network that is the managed care piece of it. The only one is indemnity insurance, and most of us do not have an indemnity insurance. Although it wouldn't surprise me if that starts to come back in popularity, where you pay so much and the insurance companies, pay a percentage, but it is definitely more like a PPO. So I hope this has been helpful. this historical concept of what managed care is. If you have any questions or stories, or if you have more information about managed care, I try to keep this really simple because it's very confusing if you haven't lived through the beginning of managed care like I have. But post your stories and your questions below, and I'd be happy to try to answer them. So, if you like this content, please like and share it with somebody that you know and follow me so that I can continue to create more information about health insurance to help us all navigate this confusing part of our healthcare system.